We're here at AHIMA 2013 with Joseph Gurrieri, Vice President and COO at HIM on call. And one of the big topics here is coders and kind of a shortage of coders, at least some people are saying so. What's your take on that?
Yes, John, there's been a shortage of coders for over 10 years now. Being in business since 1998, it's been a struggle for us to retain coders, to recruit new coders. These schools have been closing in the major cities. For example, in New York, there's not one four-year degree program. So the coding industry in and of itself is really a hidden industry. It's not something that's being promoted at the high school level, and there's less and less new coders coming into the industry. To add to that, there's going to be a major change, obviously, October 1st, 2014, with moving from ICD-10 to ICD-10. The average age of coders is about 55. There's about 16% that are over 62. There's going to be in our opinion, and what we're seeing, kind of a mass exodus of coders. A lot of people retiring. It's going to bring that shortage tremendously up, probably double what it is today. Stats, the Department of Labor, statistics from 2010 say there's a 30% shortage. So imagine that's back in 2010. We can imagine what it is now, and then compounded with the change in the methodology of coding, moving to a whole new system. There's going to be a tremendous need for coders and new coders into the industry.
So how do we solve that? I mean, should we increase the education in the U.S.? Should we look offshore? What do you think the future of solving this shortage is?
Well, I think there's a couple of things we can do. Locally, with our association, AHIMA, American Health Information Management Association, I think they're doing an okay job in trying to touch all aspects of health information management, but I think they need to do a little bit more on focusing on coding profession, and possibly even getting more into promoting and educating coders without charging them so much. I have a couple of family members who are interested in getting into coding. Some people in our office, perhaps, in hospitals at the lower level. And if the hospital's not offering coding, they're going out to medical billing schools that are being advertised on TV. They're going down a completely wrong path. That is not the coding that the industry needs. That's more of the physician, front desk type of receptionist, where they're doing a little bit of medical billing and medical coding. Those people are not trained or equipped to code in an inpatient acute care facility environment. So I think what AHIMA needs to do is do a little bit more outreach to the community, get into the high schools, build it as a career, get into the other colleges, start building the programs again. I have seen some programs through, let's say, for example, in New Jersey, all of a sudden there has been a focus on building the health information management programs in colleges, and they've gotten kind of creative. Some of the schools that have closed have actually partnered with other colleges to at least offer some courses. But again, the problem with that is the attendance is so low that the colleges just can't support the program. So again, that's one solution, is getting more active, all of us, being a spokesperson for coding, working with AHIMA, being able to offer free or less expensive coding programs. Right now, the AHIMA program, from what my research has showed me, it's about $95 per lesson. I think there's 25 lessons for ICD-10 CM, and 20-something for PCS. In addition to the prerequisites, you're looking at $5,000–6,000 to become a coder. So it's a high price tag for someone who's looking to get into a field without having to go through the expense of going through college.
So, I mean, is there an opportunity, to outsource this? I know a lot of organizations are looking at that, and I mean, is that a comfortable approach? Should we be able to trust outsourcing with our coding, or do we need more here locally?
Yeah, that's a good question. What we have done, and I think a lot of companies are doing right now, are looking offshores. We're looking at really thinking out of the box, outside of the United States, for many reasons. One, there's many more people who are in need of jobs, who have the foundation, the allied health foundation, medical terminology, the anatomy and physiology, pharmacology. People who are doctors even in other countries, willing to give coding a chance. So that's something I definitely recommend. At this point, if the resources are just not here in our own backyard, we just started to stretch out further and further. We started coding in New York City, on-site coding, using the resources in New York City, employing and creating jobs in New York, until it got to a point where there were no more resources. So we started expanding out, and remote coding was born. not by us, but by the industry, by the need, the demand. And I think there's coders now stretching all the way out in every state, in every corner of the country. Even in the Indian reservations, there's coders working from home for hospitals throughout the country. So we've done everything that we could as an organization, as an industry, to use and promote the coders within the United States. And it's gotten to a point now where the demand, really is much higher than the supply that we have here in the U.S. So we've opened up an office. HR McCall opened up the first office in India in 2005. We now have another office that we opened up, really dedicated to growing ICD-10 coders, because like I mentioned before, the shortage is going to be even greater, and the demand for coders. For example, if the productivity impact is projected to be the worst case scenario, 50% less productivity, you're going to need 2 coders for every one that you have today. There's organizations out there right now that are expecting to have to need up to 100 additional coders. These are large healthcare systems that we're talking to. And everybody, you basically just draw a map, 5-mile radius. How many hospitals are within 5 miles or 10-mile radius? Those hospitals, those organizations are looking to competing for the same coders. So I think it's just something that we're going to be forced to do, but I think we should do it, thoughtfully, carefully, and do it right.